In the third section of our lecture, now we will talk about the clinical presentations of acute bacterial meningitis. In this section, we will talk about some common presentations of bacterial meningitis, including the seizures. Once the infection reaches the brain or nervous system, seizures are common that can occur as a result of that infection. Then also there is increased intracranial pressure. So the pressure in the cranium is increased. We talked about the pathophysiology of meningitis, and if you notice that there is increase in the permeability of the blood vessels, increase in the leakage, and the edema is present. So as a result of all these changes, the intracranial pressure is increased. So there is increased intracranial pressure, and there is meningococcemia and skin lesions also present in infections, especially the infection caused by Neisseria meningitidis. So these are the presentations which we will discuss in this section. So the clinical presentations, the bacterial meningitis present as acute fulminant illness, subacute infections which worsen gradually, slowly it progress and worsen. Clinical triad of meningitis is the fever, headache, and the knuckle rigidity. These are very promising features of meningitis. Patient present with fever, there is headache, and the neck is very, very rigid and stiff. These are the promising features of acute bacterial meningitis. Nausea, vomiting, photophobia are also observed. So the light patients usually don't like too much light, and they have nausea and vomiting also. Seizures, again, common presentation is of the initial phase of bacterial meningitis. Can be focal seizures or it can be generalized seizures. The focal seizures are due to one area is affected, there is ischemia of that particular area. Ischemia is decreased supply of the blood, so due to focal arterial ischemia, or due to infarction or the death of the tissue. Also, we have cortical venous thrombosis with hemorrhage. Cortical venous thrombosis with hemorrhage is another cause of the focal seizure. So it can be due to infarction, arterial ischemia, or cortical venous thrombosis with hemorrhage that can cause focal seizures. There is also focal edema which can cause the seizures. Next we have generalized seizures, which is the status epilepticus due to hyponatremia. Decreased level of the sodium, hyponatremia can also cause generalized seizures. Cerebral anoxia, decreased supply of oxygen is cerebral anoxia, and less commonly by antimicrobial toxicity. So these are two different types of seizures: focal seizures, generalized seizures. And the causes of the generalized seizures we have like hyponatremia, cerebral anoxia, and as a result of the toxicity by the antimicrobial drugs that are used to treat meningitis, there might be a generalized seizures. Increased intracranial pressure is usually raised. The pressure in the cranium is raised, major cause of obtundation and coma. So increased intracranial pressure is the leading cause when the patient present with decreased level of consciousness. They are not very alert, drowsy, and this might lead to the coma. More than 90% of the patient usually have CSF opening pressure more than 180 millimeter of the water. 20% usually have opening pressure more than 400 millimeter of water, and the disastrous complications include the herniation. As a result of increased pressure, there is herniation or bulging of the cerebrum occur in 1% to as many as 8% of the cases. So these are the intracranial pressure. When the pressure in the brain is increased, it can cause decreased level of consciousness, decreased alertness, and coma. In more than 90% of the patient, the CSF opening pressure is more than 180 millimeter water. In 20% of the patients, the pressure is more than 400 millimeter of the water. So that's how the intracranial pressure is increased. Next, signs of increased intracranial pressure. How we will know that the pressure is increased? We have a disorientation or reduced level of consciousness, obtundation, I already mentioned. Then we have papilledema, swelling of the pupils. When ophthalmoscopy is performed, there is papilledema. Dilated, poorly reactive pupils. Sixth nerve palsy is also as a result of increased intracranial pressure. Decerebrate posturing. Cushing reflex, which is bradycardia and hypertension. The pulse rate is low and the blood pressure is high. There is irregular respiration. So all these are the signs of increased intracranial pressure. There is papilledema, decreased level of consciousness, sixth nerve palsies, decerebrate posturing, and then we have irregular respirations. These are the signs of increased intracranial pressure. Meningococcemia and skin lesions, we already mentioned there are petechiae and purpuric rash associated with the meningococcal infection. So meningococcemia, when the infection reaches the bloodstream or blood, septicemia, meningococcemia, it can lead to, besides the meningitis, also the skin lesions. And these, you can see, these are the skin lesions, rashes, which are associated with meningococcemia. Clues to the diagnosis are rash of meningococcemia, which begins as erythematous maculopapular rash, resemble viral exanthem. So a lot of viral infections like measles, chicken pox, when they have maculopapular rash, so it resembles the rash of those infections which are the viral infections. Skin lesions then become the petechiae on trunk, on the chest, and the lower extremities is common in the mucous membranes, in the conjunctiva, and also on the palms and the soles. So these are the characteristic skin lesions of the meningococcemia. Neurologic complications of meningitis, that's a big list of some neurological complications, but it only tells us how it progresses and what are the important points we should remember. First, by the invasion of, that's the subarachnoid space, SAS, space below the arachnoid. If there is empyema or infection, invasion of subarachnoid space by the pathogens, which causes the multiplication of organisms, and lysis of organism by the antibiotics. Release of bacterial cell wall components, which are endotoxin and teichoic acid. There is production of inflammatory cytokines. So same as we talked about in the pathophysiology, the same process is again, and the complications occur as a result of the lysis of the bacteria, which causes release of different endotoxins and cytokines and chemokines, which increase the permeability of the blood vessels, leading to different changes, causing edema and increase in the vascular permeability. And the ultimate result is the increase in the intracranial pressure, coma, death of the cells, brain cells. So it's pretty much the same mechanism is working here. So that was all about the third section of our lecture. Thank you for watching sqadia.com.